All right, let's talk about blood pressure. So, blood pressure, I think, is probably the hardest vital sign to get. Your normal blood pressure is greater than 95 over 60. So, some factors that will impact your blood pressure include age, race, weight, exercise, and stress. So, as we're babies, so as we're newborns, our blood pressure is really low, like a systolic of around 60 is okay. As we get older, our blood pressure will increase. In terms of race, African American patients tend to have a little bit higher blood pressure. Um, Weight, people who have a higher weight will tend to have a higher blood pressure. In terms of exercise, as you are exercising, when you are exercising, your blood pressure will be higher. As you stop, your blood pressure will kind of normalize and go back to your normal within about 5 minutes. And then stress will increase the blood pressure as well. So the blood pressure, I like to think of the blood pressure as a hose. I think that's kind of a nice way to understand it. So the blood pressure is the force of blood pushing against the side of your vessel walls. So that's the actual pressure. It's measured in millimeters of mercury, so mmHg. Your systolic blood pressure, so the top number is the maximum pressure during your left ventricular contraction. And that left ventricular contraction, that just means when your heart is pumping out the blood. So that when the blood is leaving your heart and going to the rest of your body, that's when that's occurring. There's going to be a lot more pressure as your heart is pushing the blood out. So that maximum pressure is your systolic blood pressure, that top number. Diastolic then is the resting pressure in your blood in your vessels constantly. So the pressure that is constantly exerted is your diastolic pressure. So one thing I do want you guys to be able to calculate is the pulse pressure. So to do your pulse pressure, you take your systolic blood pressure and subtract your diastolic blood pressure. So I have an example here. This patient has a um, blood pressure of 142 over 96. So to determine the pulse pressure, we take 142 and subtract 96, and that gives us 46. 46 would be our pulse pressure in this example. All right, so we have a question here. So the nurse is assessing the blood pressure of a client diagnosed with primary hypertension. Primary just means it's not caused from something else. So this is just kind of what we think of as high blood pressure. So the nurse ensures accurate measurement by avoiding which of the following. So in this question, avoiding would be one of the key words. So what are we not going to do? So A, seating the client with arm bared supported at heart level. B, measuring the blood pressure after the client has been seated quietly for 5 minutes. C, using a cuff with a rubber bladder that encircles at least 80% of the limb. Or D, taking a blood pressure within 15 minutes after nicotine or caffeine ingestion. So the correct answer is D. So we want to avoid taking the blood pressure right after somebody has smoked or drank coffee or soda or whatever. So in terms of measuring blood pressure, how we're going to do it is we'll have the patient sit with their feet flat on the floor and rest 5 minutes prior to measurement. We want to make sure there's no smoking, no caffeine, or no exercise 30 minutes before. Sometimes that's not always possible, but I want you to be aware that smoking, use of caffeine, or exercise will give you a higher blood pressure than the patient normally has. Additionally, you want to avoid an arm with an IV, fistula, or history of breast or axillary surgery on the same side. So you'll be able to see an IV. A fistula is when we combine an artery and a vein, and it gives us kind of this big, you can kind of see it's almost looks like a rock under the skin. You'll be able to actually feel a vibration or a pulsation, but this is used for dialysis. Dialysis is when somebody's kidneys are no longer working, and they go and they have this machine basically filter out all their blood, kind of the same thing their kidney would do. So that's why someone would have a fistula typically. So you can see both the IV and the fistula. You are going to have to ask your patient about history of breast surgery or axillary surgery. Axillary refers to your armpit surgery on the same side. So the concern there is with your lymphatic system. So that's a system within your body. And that kind of helps with your immunity. And so patients who have had breast surgery, a lot of times that's in relation to cancer. They are at risk for developing this lymphedema or swelling that's permanent in the arm on that side if something goes awry. So you would want to say, hey, is it okay that I use your left arm to take a blood pressure? And they may say, no, I had surgery on that side. Please use my right side. When you are obtaining the blood pressure, you are going to listen to the brachial artery. So to measure blood pressure on your blood pressure cuff, it'll have a little kind of triangle. You want to align that marker over your brachial artery. So to put that cuff on, you're going to put it on your upper arm. I like to put it maybe like 3 inches above that antecubital space where your arm bends, just a little bit above that to allow you to have room to put your stethoscope. So this is how we do a 2-step blood pressure. So our first step is we're going to estimate your systolic blood pressure. And the way you're going to do that is you're going to palpate the radial artery. So that's right by your thumb, the radial artery. Put the blood pressure cuff on the patient and inflate. So you have kind of a little, it's almost like a ball. You're just going to squeeze that to get that air in your blood pressure cuff. Squeeze it up while you're feeling that radial artery. You're going to squeeze it up until you no longer feel the artery. That's going to be at the pressure. Where is your systolic blood pressure? It's your estimate. So this is allowing you to estimate what you think the systolic blood pressure is. So you put the blood pressure cuff on, you inflate it. So let's say my blood pressure is around 115. So you put the cuff on, you inflate it, and you get around 115 is where the pulse, you stop feeling it. So that's step 1. The second step is auscultation. Remember, auscultation is listening. You're going to use you actually are going to use the diaphragm. So I apologize, there was a typo here. So you're going to use the diaphragm of the stethoscope to get the blood pressure, not the bell. So you're going to place the diaphragm of the stethoscope over your brachial artery, and then you will inflate the blood pressure cuff to 30 millimeters of mercury above what you palpated. So you palpated 115, you're going to inflate that cuff up to 145. Okay, so whatever you estimated in the palpation, that's step 1, you are going to inflate your cuff to 30 over that. So to make sure the cuff is the right size, sphygmomanometer is a fancy name for blood pressure cuff if you want to impress anybody. But in terms of measurement, the width of the bladder, so you can see there, the width of the bladder, that's where the air goes, should be 40% the circumference of the extremity. So the circumference is the area around your arm, the distance. The length then should be equal to 80% of the circumference. So if you have a narrow cuff, a cuff that's too small, you are going to get a higher blood pressure number than the patient actually has. And if it is too large of a cuff, you are going to have a falsely low. So the number you get is going to be lower than the person's blood pressure actually is. So some other errors we see in obtaining blood pressure. So with a falsely low level, again, the cuff could be too large. The cuff could be above the level of the heart. So wherever that extremity is, it could be above the level of the heart. So I have the example if a patient's laying on their side, you have one arm that's below the level of the heart and one arm that's above. So let's say they're laying on their left side, their right arm would be above the level of the heart. If you try to get a blood pressure on that arm, it's going to be very low. And then if you inflate the cuff to too low of a level and stopping, so that's another reason why it would be really good to use that 2-step blood pressure, because then on that first step, you can palpate and give yourself an estimate on where you think that systolic pressure is. Next, a falsely high level. So we talked about a cuff is too narrow or the arm is below the level of the heart. So same example, if the person's laying on their left side, their left arm is going to be below the level of the heart. So think gravity here, that blood pressure is going to be higher. So you'd want the patient to just move to their back and lay there for a little bit, and then you could get their blood pressure. And then deflating the cuff too slowly. So when you let the air out of the cuff and you're checking your blood pressure, it should move slowly out. But if it's too slow, you're going to get a falsely elevated level. So just let it go out at a kind of a consistent pace. If you let all the air out too quickly, that's fine. You can just put the cuff on and recheck. Pediatric vital signs, I want you to have an awareness of respiratory rate and systolic blood pressure, just knowing that a newborn has a lot higher respiratory rate than an adult, and a newborn also has a lot lower systolic blood pressure than an adult.